Welcome back, students. Today we will be dealing with one of the important topic known as acute diarrheal disease. So, what is acute diarrheal disease? The sudden startage of the diarrhea, and it will be less than 2 weeks of duration. And if we see detail, some of the red flags or some of the major features of acute diarrhea would be the bloody diarrhea, if there is a bloody diarrhea, if there is a abdomen pain, and the fever or the temperature is more than 38 degrees Celsius, and if the patient is immunocompromised and the patient is more than the age of 70 years, and there could be a chance of getting the dehydration. These are the major red flags or causes, factors, and major features of the acute diarrhea. So if these are all absent, then you can start with the symptomatic therapy. Okay, and the etiology or the causes would be viral. What you can do is fluid therapy, that can be oral. If it is not, if you cannot take oral, then you can give intravenous. You can also give antidiarrheals like loperamide, bismuth subsalicylate if needed. So this, if the patient is not having these conditions. Okay, if the patient is not having blood diarrhea, no abdomen pain, no fever more than 38 degrees Celsius, patient is not immunocompromised, age is more than 70 years, and if the patient is dehydrated, in these cases you can start the symptomatic therapy. Okay, what if these red flags or the characteristics are present? Then you should ask the patient whether he was admitted in the hospital recently. So, if the answer is yes, then it could be because of the bacterium Clostridium difficile. Okay, that would be one of the causes. So, which are the antibiotics that usually due to the taking of antibiotics, okay, in the hospital admission? So, which are the antibiotics will lead to the growth of the Clostridium difficile? That is clindamycin, ampicillin or amoxicillin, cephalosporin, that is the second or third generation cephalosporins. So what you should do is you should do a Clostridium difficile PCR. That is the test you should do. And the treatment should be started immediately with the first line drug called metronidazole per oral medications. Okay, and which are the doses present in the metronidazole? Usually 400 mg tablet will be available. And the second line is vancomycin is an antibiotic, and it usually given in the salmonella related, sorry, not salmonella, staphylococcus aureus resistant case, we will give vancomycin. But here also we can give for the diarrheal disease, that is acute diarrheal disease. So the second line drugs are vancomycin, that can be given orally, or fidaxomicin also can be given. And if it is not working or the treatment characteristic is not reducing, then you can start with the fecal transplant. Healthy fecal transplant can be done so that the good bacteria can grow inside the colon of the patient. Okay, that would be the treatment. So if the patient, that is about the, if the patient was admitted in the hospital and antibiotics were given, this is about the one content. Next is the patient was not admitted in the hospital, okay, and the antibiotics were not given. So what you should do is you should investigate, like fecal RBC should be taken, WBC can be done, that is the checking, and the stool culture also can be done. And you should check for the stool ova and parasite. If there is an egg or the parasite or egg can be checked, that is the investigation you should do. And also you should ask for if there is any travel to the endemic area. That is the one more question you should ask. And you can also check with the waterborne outbreak in any of the area the patient was traveled. So this is the investigate you can do. Same investigation you can do if there is no improvement in the symptomatic therapy. So as I told, these red flags were absent, you gave this medication and still this the diarrhea is not controlling, then you can start with this investigation, okay, if there is no improvement. So the investigation found out these characteristic or the values. Before that, you will send these findings or these fecal stool or stool over for real, all this you send it to the lab investigation, but it will take time to get the result. So by the time, what you will do, you cannot leave the patient as such. You can start with the ciflox, that is ciprofloxacin plus metronidazole treatment, that is the empiric therapy by the time patient results are come. So this is empiric therapy, but after the result have been come, you will check for these things. So what are these? First, if there is a presence of RBC, WBC in the stool, as also, and also there is a stool culture shows inflammation. Okay, inflammation for E. coli, that is the type is 0157H7, and there could be a chance of having the salmonella, shigella, campylobacter. These are the bacteria present, so that is the one. And the second one is RBC is absent, WBC is also absent, stool culture is non-inflammatory. So what you will do, you will confirm it as a enterotoxin, Vibrio cholera, Bacillus cereus, Clostridium perfringens. So these could be the bacteria causing this acute diarrhea. And you will also check for stool ova and parasite if there could be a presence of Giardia lamblia, Entamoeba histolytic, or Cryptosporidium. So these are the parasite that would present. And RBC is present, WBC is present, stool culture where you will see ova and parasite also present. If doesn't resolve, investigate the chronic diarrhea, that's also called as IBD. Okay, these could be the reason. After all this checking, if these are absent or if there is no not resolve even after the treatment, then you can check for the chronic diarrhea. So, what are the major causative agent? Those are inflammatory diarrhea, where invasion or it is painful again, and campylobacteria or campylobacter, that could be from the poultry, that is a most common cause. Salmonella from poultry or eggs. E. coli, the type is 0157 by H7, that could be from the hamburger. So you are not supposed to use antibiotics. There are risk of HUS here. And if there is a Entamoeba hysterica, that can be coming from the water, that is contaminated water, homosexuality, immunocompromised patient. These are the reasons in the Entamoeba histolytica. And if there is a presence of Shigella, that could be from the contaminated food or water. Okay, those are the major inflammatory diarrhea. And if there is no inflammation, that is non-inflammatory diarrhea, and presence of enterotoxin or non-invasive, that could be from staphylococcus aureus toxin, that would be from salads, dairy products. Here vomiting will be predominant. You can see the patients are vomiting frequently. And Bacillus cereus can be from the reheated rice. Vibrio cholera, that is also called that will produce this rice water stool. That's the cause of rice water stool is Vibrio cholera. So here water will be contaminated with the feces. If the patient to drink this water, then he would get Vibrio cholera diarrhea. And enterotoxigenic E. coli, it's also called as traveler's diarrhea. That would be from the contaminated water too. And again, giardia, that could be from the unfiltered water. Here, camping trip will be present. And if they are not eradicated, then it will mimic the celiac disease. Okay, it will mimic like a celiac disease. So that is what about the uh, acute diarrheal disease. We'll see in the next chapter. Thank you.